If you know the story of Marguerite Duville, she took over a hospital that was really dying. It was falling apart physically and emotionally. And Marguerite Duville took over that hospital. She rebuilt it. She took care of the poor. Hospitals in the 1700s were not like they are today. They inspired me with the way that they took care of the poor and the elderly, and they were so kind and good. And I said, gee, you know, I could become a Grey Nun. I'd like to remain a nurse, and that's a nursing congregation and social work. So I entered the Grey Nuns in 1967.
I guess I was in high school. I went into nurses training, and I met the Grey Nuns there, and I was very edified by them. That's when I think my vocation flourished.
It was the spirit of Marguerite Duville. That's what really attracted me to the Grey Nuns.
I think we're all called to something, to reach out to others, no matter who we are, no matter what our life situation is. And I think as Grey Nuns, if I listen to the stories of our sisters, they always reached out.
Well, I think working with the homeless is really the one that brings a big smile. I used to volunteer with the poor at shelters or at soup kitchens. It was really rewarding.
If I didn't have the sisters, I would be lost. They are my strength, you know, and when we work together, I think we can produce a lot more.
But I remember our sisters in the years and years ago who worked with orphans. And those orphans, those sisters lived with the orphans. They'd have 50 kids in a bedroom with one sister. I always gave them a lot of credit. They were inspiration for me. So I think it's important that we understand that the strength comes from your spiritual life.
When I was in Lawrence, Sister June was a provincial, and she called and asked me if I would help to do a needs assessment for the homeless of Lawrence. So I did. And then I began Lazarus House. And then after that, I was at St. Mary's Church in Lawrence, and then I started a House of Hope. It was a shelter for the homeless also.
I feel close to the sisters. I think they help me to be who I am.
And so our role today is to be who we can be. I'm 84 years old now. The world has changed a lot. I worked in our institutions before there was no health system. Every institution was by itself. And I've been through all those transitions.
If you read the life of Mother Duville, she was constantly, you know, changing and doing what she had to do. So that was our inspiration.
I think we need people that are not afraid to evolve in the way we develop institutions or covenant health systems.
I think it's wonderful to have foresight and be able to have a wonderful imagination that can bring us forward.
The lay people always work with us. So with covenant, we can continue as we are with the laity. Allow the laity to really bring us along.
And we're very pleased with the management team and everything that they do. It's marvelous.
If we didn't have covenant, we couldn't go on. So that's vital. That's very important.
I think it's a relief for the congregation not to have that responsibility, especially because we're not very numerous, and we need many more capable people to continue.
I used to have my own mission statement, to make the love of God known by the way I live and minister to others. And I wish that same thing for Covenant.
And it's so nice now to see the progress that they have made, you know, and the things that they're doing.
I'm very proud of Covenant. I think they've been true to the mission as they move into the future. They've hired a lot of creative people and people who are committed to healthcare, Catholic healthcare today. It's physical care, it's emotional care, and it's family care, because families are usually upset when somebody's really sick, and it's spiritual care. So I think that's important. in the future, and I'm proud of Covenant.
We need the Grey Nuns to make a difference in the world. I think that's what we do. I think the Grey Nuns do make a difference in the world.
I'm grateful for my vocation to be a Grey Nun, and I pray that I'll be faithful to the end, do whatever ministry that I'm called to.
So our role is to really live this moment, to live this time, to be the best we can be at Covenant, to let it evolve on its own. And evolution is something that grows on its own, and it moves where the need might be.